Pain in your belly. If you ever experience severe pain in your belly or one side of your back that comes and goes suddenly, you may be passing a kidney stone. Let's talk about the painful condition of kidney stones. Kidney stones are hard deposits made of minerals and salt that form inside your kidneys. They are also called renal calculi, nephrolithiasis or urolithiasis. Diet, excess body weight, some medical conditions, and certain supplements and some medications are among the many causes of kidney stones. Kidney stones can affect any part of your urinary tract, from your kidneys to your bladder. Often, stones form when the urine becomes concentrated, allowing minerals to crystallize and stick together. Passing kidney stones can be quite painful. But the stones usually cause no permanent damage if they're recognized in a timely fashion. In general, you may need nothing more than to take pain medication and drink lots of water to pass a kidney stone. If stones become lodged in the urinary tract and are associated with a urinary infection or cause complications, surgery may be needed. Your doctor may recommend preventive treatment to reduce your risk of recurrent kidney stones. Renal calculi are a common cause of blood in the urine, hematuria, and pain in the abdomen, flank, or groin. They occur in 1 in 11 people at some time in their lifetimes, with men affected 2 to 1 over women. Development of the stones is related to decreased urine volume or increased excretion of stone-forming components. They include calcium, oxalate, uric acid, cystine, xanthine, and phosphate. Calculi may also be caused by low urinary citrate levels or excessive urinary acidity. Renal calculi present with excruciating pain, and most patients reach the emergency department in agony. A single event does not cause kidney failure, but recurrent renal calculi can damage the tubular epithelial cells. It can lead to functional loss of the renal parenchyma, functional tissue. Types of kidney stones. The type of kidney stone helps to determine its cause. It may give clues on how to reduce your risk of getting more kidney stones. If possible, try to save your kidney stone if you pass one so that you can bring it to your doctor for analysis. Types of kidney stones include calcium stones. Most kidney stones are calcium stones, usually in the form of calcium oxalate. Oxalate is a substance made daily by your liver or absorbed from your diet. Certain fruits and vegetables, as well as nuts and chocolate, have high oxalate content. Dietary factors: high doses of vitamin D, intestinal bypass surgery, and several metabolic disorders can increase the concentration of calcium or oxalate in urine. Calcium stones may also occur in the form of calcium phosphate. This type of stone is more common in metabolic conditions, such as renal tubular acidosis. It may also be associated with certain medications used to treat migraines or seizures. They include topiramate, Toponex, Trokendi XR, Qdexy XR. Calcium stones are due to hyperparathyroidism, renal calcium leak, hyperoxaluria, hypomagnesemia, and hypocytraturia. Struvite stones. Struvite stones form in response to a urinary tract infection. These stones can grow quickly and become quite large, sometimes with few symptoms or little warning. Struvite stones are caused by gram-negative urease-positive organisms that break down urea into ammonia. Common organisms include Pseudomonas, Proteus, and Klebsiella. E. coli is not associated with struvite stones. Uric acid stones. Uric acid stones can form in people who lose too much fluid. It could be due to chronic diarrhea or malabsorption. It may occur in those who eat a high-protein diet, and those with diabetes or metabolic syndrome. Certain genetic factors also may increase your risk of uric acid stones. Uric acid stones are associated with a pH of less than 5, a high intake of purine foods, fish, legumes, meat, or cancer. These stones may also be associated with gout. Cystine stones. These stones form in people with a hereditary disorder called cystinuria. Cystinuria causes the kidneys to excrete too much of a specific amino acid. Cystine stones are due to an intrinsic metabolic defect causing the failure of the renal tubules to reabsorb cystine, lysine, ornithine, and arginine. Causes of kidney stones. Kidney stones often have no definite, single cause, although several factors may increase your risk. Kidney stones form when your urine contains more crystal-forming substances, such as calcium, oxalate and uric acid, than the fluid in your urine can dilute. Lack of substances. At the same time, your urine may lack substances that prevent crystals from sticking together, creating an ideal environment for kidney stones to form. Urolithiasis occurs when solutes crystallize out of urine to form stones. Urolithiasis may occur due to anatomic features leading to urinary stasis. Low urine volume, dietary factors, for example, high oxalate or high sodium. Urinary tract infections, systemic acidosis, medications, or uncommonly genetic factors such as cystinuria. The most common cause of stone disease is inadequate hydration and subsequent low urine volume. The other four most common factors contributing to urinary stone formation are hypercalciuria, hyperoxaluria, hyperuricosuria, and hypocytraturia. Many drugs are known to cause stones and include the following: atazanavir, indinavir, triamterene, guaifenesin. Overuse of silicate, sulfonamide. There also appears to be a genetic association to renal calculi. In some families, there may be mutations that cause a defect in the renal tubular handling of calcium and other substrates. What's the urinary tract? How does it work? Your urinary tract is vital to your body because it gets rid of waste and extra fluid. It's made up of your kidneys, 2 ureters, your bladder and your urethra. Each organ has an important job, in the following order. Kidneys. Your fist-sized, bean-shaped kidneys are located on either side of your spine, below your rib cage. Each day they filter 120 to 150 quarts of your blood to remove waste and balance fluids. Your kidneys make 1 to 2 quarts of urine every day. Ureters. After your kidney creates urine, the liquid travels through the tube-shaped ureter to the bladder. There is 1 ureter per kidney. Kidney stones can pass through the ureters or, if they're too big, get stuck in them. You may require surgery if the stone is too large. Bladder. Between your hip bones is your bladder, an organ that stores urine. It stretches to hold about 1.5 to 2 cups. Urethra. Like a ureter, your urethra is a tube through which urine passes. It's the final stop of the urinary tract where your urine, and a kidney stone, leaves your body. This is called urination. If I have multiple kidney stones, are they all made of the same substances? The materials that make up a kidney stone can be different. You could develop a calcium oxalate stone and one made of uric acid. What are the symptoms of kidney stones? You can have a stone in your kidney for years and not know it's there. But, when it starts to move or becomes very large, you may have symptoms. Symptoms of a kidney stone include 1. Feeling pain in your lower back or side of your body. This pain can start as a dull ache that may come and go. It can also become severe and result in a trip to the emergency room. 2. Having nausea or vomiting with the pain. 3. Blood in your urine. 4. Pain while urinating. 5. Being unable to urinate. 6. Feeling the need to urinate more often. 7. Fever or chills. 8. Urine that smells bad or looks cloudy. Smaller kidney stones may not cause pain or other symptoms. These silent stones pass out of your body in your urine. What are the symptoms of kidney stones in children? A. The most common symptoms of kidney stones are blood in the urine or pain. The amount of pain your child experiences and where it hurts depends on where the stone is located and its size. Other symptoms include B. Severe colicky pain. C. Inability to urinate, when a stone blocks the urinary tract. D. Nausea or vomiting. E. Cloudy, foul-smelling urine, fever, chills or weakness which might be a sign of a serious infection. Most pediatric kidney stones remain in the kidney, but up to a third may migrate from the kidney and get stuck in a ureter. Stones that remain in the kidney, although often painless, can be the source of recurrent urinary tract infections. Those that lodge in the ureter can create severe colicky pain. Risk factors for kidney stones. Factors that increase your risk of developing kidney stones include 1. Family or personal history. If someone in your family has had kidney stones, you're more likely to develop stones. 2. If you've already had one or more kidney stones, you're at increased risk of developing another. 2. Dehydration. Not drinking enough water each day can increase your risk of kidney stones. People who live in warm, dry climates and those who sweat a lot may be at higher risk than others. 3. Certain diets. Eating a diet that's high in protein, sodium, salt, and sugar may increase your risk of some types of kidney stones. This is especially true with a high sodium diet. Too much salt in your diet increases the amount of calcium your kidneys must filter and significantly increases your risk of kidney stones. 4. Obesity, high body mass index, BMI, large waist size and weight gain have been linked to an increased risk of kidney stones. 5. Digestive diseases and surgery. Gastric bypass surgery, inflammatory bowel disease or chronic diarrhea can cause changes in the digestive process that affect your absorption of calcium and water. It increases the amounts of stone-forming substances in your urine. Other medical conditions such as renal tubular acidosis, cystinuria, hyperparathyroidism and repeated urinary tract infections also can increase your risk of kidney stones. Certain supplements and medications, such as vitamin C, dietary supplements, laxatives, when used excessively, calcium-based antacids, and certain medications used to treat migraines or depression, can increase your risk of kidney stones. Diagnosis of kidney stones. If your doctor suspects that you have a kidney stone, you may have diagnostic tests and procedures, such as blood test. Blood tests may reveal too much calcium or uric acid in your blood. Blood test results help monitor the health of your kidneys and may lead your doctor to check for other medical conditions. Urine test. The 24-hour urine collection test may show that you're excreting too many stone-forming minerals or too few stone-preventing substances. For this test, your doctor may request that you perform 2 urine collections over 2 consecutive days. Imaging tests may show kidney stones in your urinary tract. High-speed or dual-energy computerized tomography, CT, may reveal even tiny stones. Simple abdominal X-rays are used less frequently because this kind of imaging test can miss small kidney stones. Ultrasound, a non-invasive test that is quick and easy to perform, is another imaging option to diagnose kidney stones. Analysis of past stones. You may be asked to urinate through a strainer to catch stones that you pass. Lab analysis will reveal the makeup of your kidney stones. Your doctor uses this information to determine what's causing your kidney stones and to form a plan to prevent more kidney stones. How are kidney stones treated? Once diagnosed, your doctor will first determine if you even need treatment. Some smaller kidney stones may leave your system when you urinate. This can be very painful. If your doctor decides that you do need treatment, your options include medications and surgery. Medications may be prescribed to 1. Decrease pain. Your doctor may recommend that you take an over-the-counter medication like ibuprofen. Or, if you're in the emergency room, an IV narcotic. 2. Manage nausea or vomiting. 3. Relax your ureter so that the stones pass. Commonly prescribed medicines include tamsulosin, Flomax, and nifedipine, Atimin or Procardia. You should ask your doctor before you take ibuprofen. This drug can increase the risk of kidney failure if taken while you're having an acute attack of kidney stones, especially in those who have a history of kidney disease and associated illnesses such as diabetes, hypertension and obesity. Surgery. There are 4 types of surgeries used to treat kidney stones. The first 3 are minimally invasive, meaning that the surgeon enters your body through a natural opening, like your urethra, or makes a small incision. 1. Ureteroscopy. To perform this procedure, A small instrument called an ureteroscope is inserted in your urethra, through your bladder and into a ureter. This instrument shows the kidney stones and then retrieves them in a surgical basket, or breaks them apart using a laser. These smaller pieces of the kidney stones are then easily able to exit your body through your urinary tract. 2. Shockwave lithotripsy. In this procedure, you are placed on a special type of surgical table or tub. High-energy shock waves are sent through water to the stones. The shock waves break apart the stones, which are then more easily able to exit your body. 3. Percutaneous nephrolithiasis. When kidney stones can't be treated by the other procedures, either because there are too many stones, the stones are too large or heavy, or because of their location, percutaneous nephrolithiasis is considered. In this procedure, a tube is inserted directly into your kidney through a small incision in your back. Stones are then disintegrated by an ultrasound probe and suctioned out so that you don't have to pass any fragments. A urethral stent is placed after the procedure. It is an internal tube from the kidney to the bladder which is removed 1 week later. Patients are typically kept overnight for observation. 4. Open stone surgery. A longer cut is used during this surgery. Compared to minimally invasive procedures, it's rarely performed, 0.3% to 0.7% of cases. How are children treated for kidney stones? Most children's kidney stones can be treated with the shockwave lithotripsy, SWL, a completely non-invasive procedure. Your child is placed under anesthesia and sound waves of specific frequencies are focused on the stones to shatter them into fragments small enough to be easily passed during urination. Passing a kidney stone. Passing a kidney stone is a process that typically occurs in stages over a period of several weeks. Here are the stages that occur when passing a kidney stone. Stage 1. After a kidney stone has formed, you may experience spasms as your kidneys try to push out the stone. This can cause severe pain in your back or side, which may come and go in waves. Stage 2. During this stage, the stone enters the ureter, which is the tube that connects the kidneys to the bladder. Depending on the size of the stone, this stage can also cause feelings of pain and intense pressure. Stage 3. Once the stone has reached the bladder, most of the pain will subside. However, you may feel an increased pressure in the bladder and a need to urinate more frequently. In some cases, the stone may temporarily get stuck at the opening of the urethra, which could block the flow of urine. Stage 4. The final stage occurs once the stone has reached the urethra. During this stage, you need to push hard to pass the kidney stone with the urine through the opening of the urethra. How long does it take to pass a kidney stone? The amount of time that it takes to pass a kidney stone can vary depending on the size of the stone. Generally, small stones are able to pass through the urine within 1 to 2 weeks, often without any treatment. On the other hand, larger stones may take 2 to 3 weeks to move through the kidneys and into the bladder. Stones that don't pass on their own within 4 weeks typically require medical treatment. How long does it take to pass a kidney stone? The amount of time it can take for you to pass a kidney stone is different from another's. A stone that's smaller than 4 millimeters may pass within 1 to 2 weeks. A stone that's larger than 4 millimeters could take about 2 to 3 weeks to completely pass. Once the stone reaches the bladder, it typically passes within a few days, but may take longer, especially in an older man with a large prostate. However, pain may subside even if the stone is still in the ureter. So it's important to follow up with your doctor if you don't pass the stone within 4 to 6 weeks. Foods that can cause kidney stones. In addition to drinking more water, making modifications to your diet could also help prevent kidney stones. Here are some foods that you may need to limit or avoid. Beef, chicken, pork, organ meats, fish, shellfish, eggs, milk, cheese, yogurt, processed meats, fast food, frozen meals, salty snacks. Animal proteins like meat, poultry, seafood, and dairy products can increase levels of uric acid in your urine and increase the risk of developing kidney stones. Are there any foods or drinks that help treat kidney stones? Are there any home remedies? There are 3 liquids rumored to help with kidney stones. Cranberry juice. Although cranberry juice can help prevent urinary tract infections, UTIs, it doesn't help with kidney stones. Apple cider vinegar. Vinegar is acidic and it can sometimes create changes to your urine, which helps with kidney stones. But this doesn't always help. Talk to your doctor about the use of vinegar. Lemon juice. Lemon juice is rich in citrate, which can help prevent kidney stones from forming. Citrates are found in several citrus fruits including lemons, limes, oranges and melons. Coffee. Studies show that coffee may decrease your risk of developing kidney stones. Avoid soda and other drinks with added sugar or fructose corn syrup. They increase your risk. Prevention of kidney stones. Prevention of kidney stones may include a combination of lifestyle changes and medications. Lifestyle changes. You may reduce your risk of kidney stones if you drink water throughout the day. For people with a history of kidney stones, doctors usually recommend drinking enough fluids to pass about 2.1 quarts, 2 liters, of urine a day. Your doctor may ask that you measure your urine output to make sure that you're drinking enough water. If you live in a hot, dry climate or you exercise frequently, you may need to drink even more water to produce enough urine. If your urine is light and clear, you're likely drinking enough water. Eat fewer oxalate-rich foods. If you tend to form calcium oxalate stones, your doctor may recommend restricting foods rich in oxalates. These include rhubarb, beets, okra, spinach, Swiss chard, sweet potatoes, nuts, tea, chocolate, black pepper and soy products. Choose a diet low in salt and animal protein. Reduce the amount of salt you eat and choose non-animal protein sources, such as legumes. Consider using a salt substitute, such as Mrs. Dash. Continue eating calcium-rich foods, but use caution with calcium supplements. Calcium in food doesn't have an effect on your risk of kidney stones. Continue eating calcium-rich foods unless your doctor advises otherwise. Ask your doctor before taking calcium supplements, as these have been linked to increased risk of kidney stones. You may reduce the risk by taking supplements with meals. Diets low in calcium can increase kidney stone formation in some people. Ask your doctor for a referral to a dietitian who can help you develop an eating plan that reduces your risk of kidney stones. Should I cut calcium out of my diet if I develop calcium oxalate kidney stones? If you develop kidney stones composed of calcium, you may be tempted to stop eating foods that include calcium. However, this is the opposite of what you should do. If you have calcium oxalate stones, the most common type, it's recommended that you have a diet higher in calcium and lower in oxalate. Foods that are high in calcium include cow's milk, yogurt, cheese, broccoli, kale, calcium-fortified juices, dried beans, salmon, calcium-fortified hot cereal. Foods that are high in oxalates include, reduce these in your diet: spinach, rhubarb, strawberries, tea, dried peas and beans, nuts and nut butters, wheat bran. It's also important to drink plenty of fluids to dilute the substances in your urine. The outlook for kidney stones is very positive, although there is a risk of recurrence. Many kidney stones pass on their own over time without needing treatment. Medications and surgical treatments to remove larger kidney stones are generally very successful and involve little recovery time. It's possible to get kidney stones multiple times throughout your life. If you keep developing kidney stones, your doctor may work with you to discover why the stones happen. Once the cause is found, you may be able to make dietary changes to prevent future stones.